Hi friends, in today's video I'm just showing you this case. It's a simple case that we are going ahead with. This patient is relatively young, around in her mid 30s, and we have got her AMH done, which is a little bit on the lower side. So this patient ideally requires an IVF, but this is a case who cannot afford IVF. So we thought of doing this case on charitable basis. However, what happens is on charitable basis also IVF for low AMH is very expensive, and basically the hospital and me personally we could not afford to do this case. So what we could personally afford is to do this case for super-ovulated IUI. So let me just show you what all we can learn from this particular case. So today is the final day of stimulation. She has taken injections for close to 10 days. Let us see her endometrial thickness. Her endometrial thickness is roughly around 5.9 that you can see. Okay, a letrozole followed by injections is what we have given. We have given her HMG 300 IU daily. Now HMG 300 IU, as you know, is the dose that is given for most cases of IVF. But however, in a case of low ovarian reserve, I'll show you what's the effect of HMG. So basically I'll first teach you how the endometrium is to be screened. So when you are seeing the endometrium, we put in the Doppler window, which is this window over here, and we see that the flow is not so very exciting. Now I would draw your attention to this number over here called PFR. Okay, it is 0.8. The right PFR to be used is either 0.5 or 0.3. 0.3 is the ideal one, and the moment you do the changes and set up the machine properly, you'll come to know the flow is quite good. You can see that the flow comes from outside, goes up till this line, and also there are one or two places where you can have that flow reaching inside. Yes, there is a little bit of movement artifact from my hand, but you can make out at some places like over here that the flow is going inside these lines also. So this is showing you that the vascularity of the endometrium is really good. A good approach that I would like to say when I like to do it is that I rest my elbow on the patient table. That way I don't get these movement artifacts that you see over here. Okay, so also in the uterus you have to turn the probe from side to side and see whether there is any tumors like fibroids, adenomyosis, and here luckily we don't have any of those. Now I'll draw your attention to the adnexa. This is the right ovary of the patient, and this is the follicle that you see. Always remember, a follicle is a three-dimensional structure, so always take the view into different sides. So this is exactly how you have to do the measurements. It's a very basic video. Measurement is taken from here to down, down to up, and again one more side to side measurement. So there are two side to side measurements and one down to up measurement, and this is the final result. This 21 mm, 19 mm and 20 mm. Very nice and very good. Let us see the other side. The other side we can see again the same thing, another follicle, and you can also make out apart from this follicle there are no other follicles that you are seeing. So this ovary is maximally stimulated, and this is the maximum power of this ovary. So in case we were to do IVF for this woman, the number of oocytes, mature oocytes that you would get is 0, 1 or 2. So you won't get the third oocyte because there's no third follicle. So as a result, you may get 0 mature oocytes, you may get 1 mature oocyte, or you may get 2 mature oocytes if the patient is lucky. So again over here you can see two side to side measurements and one down to up measurement, 18 mm, 20 mm, 21 mm. So two fully matured follicles you get over here. Definitely you can go in for the Doppler assessment of every egg and everything, but then again that is something that I have already done yesterday and I'm happy with it. So I hope today's basic video was good enough for you to understand that yes, in a case of low ovarian reserve you can go ahead and stimulate, but this is the end result that you get. That's only 2 eggs, which from an IUI perspective is very amazing, but from an IVF perspective you can imagine what would be the result. So also what happens is if you keep on doing IVF for low ovarian reserve, you have to repeat this case 3 or 4 times, do luteal phase stimulation also, all that thing, once you do after 2 to 3 attempts or 3 to 4 attempts, you will find that there would be one good looking blast that you can transfer into her endometrial cavity and pray for the best. I hope it was informational. Do like and subscribe. Thank you.